As you alluded to, the connection between poverty and poor health is well known, and evidence is emerging linking hunger and obesity. According to the U.S. Census Bureau, nearly a quarter of the children in Texas live in poverty, and our center's SPAN survey found roughly the same 1 in 4 rate of obesity among 4th grade students. Where do efforts to support healthy eating among children intersect with those to reduce child poverty?
Well, thank you for that question. And what you mentioned is such an important point, that connection between poverty and poor health. And while it may seem so obvious to many of you in the room who are have been working on this area for many years, it's not actually obvious to everyone in the country, because too often we see health as just one of many sectors, a sector separate from transportation, from commerce, from housing, from urban development. But if we really want to address poverty and health, then we have to see them as part and parcel of the same problem, which means that we have to ensure that these various sectors, which have become siloed over time, are actually working together and see the improvement of health as their common goal. I was talking to some of the students actually earlier today, and I shared an observation with them, which is that every department that one might work in the federal government, state or local government, even though they have their own expertise in housing and urban development and transportation, they all recognize that tallying their costs and understanding financial impact, budget impact, is important. And so they do it. Now, the same, I believe, should be true about health, which is that the policies in all these areas have an impact on health. The question is, and we saw that very clearly in Flint, where decisions made about water, for example, can have a profound impact on health. Economic development decisions can have a big impact on health. So I would love to see us move to a way of operating where we recognize the health impact in all of our policies, and where sectors work together to achieve common goals around health. And a key part of that is going to be economic development. It's going to be addressing poverty. But addressing poverty is not something the health sector can do alone. It's something that we require other sectors to work on with us. It requires us to work with commerce and economic development. It requires us to think about housing, recognizing that many people who live in public housing may live in situations where they have exposure, for example, to secondhand smoke, which can have health implications, which is why this Secretary Julian Castro, the Secretary of Housing and Urban Development, and I and others in the federal government have been working together to see how we can protect people in public housing from secondhand smoke. It's this idea of collaboration between sectors that's also behind the creation of the National Prevention Council. The National Prevention Council is an entity that was set up in the federal government through the Affordable Care Act. It's a somewhat actually little-known entity from the ACA. Most people don't realize how much work was done on prevention through the ACA. But the National Prevention Council has representatives from all of the major federal agencies. And the reason it does that is because it recognizes that if we want to improve health, that we need the participation of all sectors. It's not something that traditional departments of health can do on their own. So I think that this connection between poverty and health is essential, but I think that the way that we are going to address it is by bringing sectors together to play their role in improving health through the policies that they control. And this is where I think there's a new role for public health. Because I would love to see public health leaders of the future be conveners. The conveners of different sectors who help them understand the impact they can have, and then who work hand in hand with them to ensure that their policies are optimizing health.
That's interesting that you would say that. We did a survey of the Texas legislators in 2013, and it was real obvious that they saw health as an individual issue, not necessarily involving places we might think of as intervention in terms of grocery stores or transportation or the like. So.
Yeah, and this points to just a larger culture change and mindset change that we have to pursue, because it's interesting that you found that in Texas, but I would venture to say Texas is not unique in that regard, in that even in Washington, D.C., I encounter leaders who really want to improve health. Their heart's in the right place, but they don't recognize that. But their view of what our tools are for improving health are largely limited to new medicines, new medical technology, hospitals, clinics, training doctors and nurses. Whereas in reality, we know from a public health perspective that making fruits and vegetables affordable could actually be a very powerful public health intervention. We know that building sidewalks and safe walkways and bike paths could also be a powerful intervention. We know that building emotional well-being programs in schools, as I shared some examples of, that this too can be an extraordinarily powerful health intervention. So part of what we have to do as public health leaders is some education, honestly, is we have to help people understand that this isn't just a pie-in-the-sky idea, but that there is data to back up the idea that policies in non-traditional or non-health sectors have a profound impact on health. And if we can understand that, if we can get policymakers to understand that, then we can start to shape policies that ultimately don't have unintended effects on health, which unfortunately sometimes happens.